Hi, and welcome to Life Addictions, the recovery show, where we talk about life addictions, whether it's drugs or alcohol. My name is John Lausch, and I am a certified recovery specialist in the state of Florida. And today we have a very special guest. As we do every week, Dr. Fernandez is here from the VA Center here in West Palm Beach. Doctor, please introduce yourself. Thank you for coming, and tell us a little bit about what it is you do.
Good morning. Thank you. Thank you for having us. I am the Chief of Mental Health at the West Palm Beach VA, and our department has a wider range of psychiatric and mental health services for our veterans.
Excellent, excellent. So you have a wider range of services for veterans. Talk a little bit to us about addictions and, in general, what it is you provide for those veterans.
Sure. The service as a whole provides all kinds of mental health services. We have an inpatient program, we have outpatient programs, mental health services for PTSD, substance abuse, major psychiatric illnesses, as well as recovery programs, not only for substance abuse but for veterans with severe mental illness.
I see.
And we have PTSD specific programs also, which are important for our veteran population.
Now I'm just trying to envision some of your clientele. And when it comes to mind, I have the vision of the older veterans from like the Vietnam War and stuff. But it's changed over the years, hasn't it?
It has. Our catchment area is interesting because we have a wide range of veteran populations. We have the older veterans, and we don't have any more World War I veterans, but we do still have World War II and Korean War. A lot of Vietnam era veterans, as well as the newer Operation Iraqi Freedom and Enduring Freedom, as well as the Afghanistan operation.
I see. And out of all the substance abuses you have, what's the most prevalent one that you see today?
For us, it would probably be alcohol abuse.
Is that right? Okay.
And I think that would be different depending on the location. A lot of the inner city settings have more of the heroin or methamphetamine out west.
Right.
So it really does depend on where you're located. For us here in Palm Beach County, it's mostly alcohol, and then that's followed up by opiate analgesics.
Right. And what's the age frame? So you have alcohol, you have the opiates, and what would be the age frame? Would alcohol be age appropriate for like the older veterans, or it doesn't matter?
Age appropriate, I guess. Alcohol is probably more ubiquitous because it is available to anyone over 21, so you see that across the board. And then depending on the individual, you may get into different types of drugs. The older vets are more likely using alcohol,
right,
although some of the Vietnam era vets do use heroin or opiates.
Right.
There's a smattering of cocaine and other drugs. The younger veterans, there's a mix also.
Right.
It's, alcohol is usually the predominant one because it is available.
Right.
And then you get cannabis, all kinds of other things, cocaine, crack. So it really depends on where you are. Further south in urban settings like Miami, you get a lot more crack cocaine. Up in New York City, for example, you get a lot more heroin.
I see.
So we see a lot of opiate and a lot of alcohol and some benzodiazepines.
You know, we did a show just a couple weeks ago, and we had Paul Sloan on, which was the Florida president of the Pain Clinics Association. And they recently passed a law here in Florida trying to shut down some of those pain clinics. But I did some further research, and a lot of rehabs, depending where it is you go and what kind of rehab it is, but 8 out of 10 people that are now are for opiates and prescription drug addiction. So you see a big rise in that?
I don't know if I could say we see a big rise, but we see a lot of people that are abusing opiate analgesics.
I see.
And it's kind of the pattern in the community in general, and we see it in the VA as well. So it's something that we treat very aggressively. We have a buprenorphine clinic, Suboxone, which is a newer treatment for it, which is a great medication, and it's hopefully going to take the place of methadone. And the advantages are that you can come once a month and get your monthly supply. You don't have to go to the methadone clinic regularly, and more importantly, as different than methadone, you can't overdose on it, you can't kill yourself on it.
Right.
Whereas methadone is still pretty lethal if you don't use it appropriately.
Yeah, Suboxone is a great drug.
Excellent drug.
Excellent drug. Let me see here. Let me just check my notes. And what kind? Do you have an inpatient 30-day treatment center, 60-day, 90-day?
We don't. Our facility doesn't have that yet. We're looking to do that sometime in the future. What we have currently is we do our inpatient detox, whether it be on the psychiatric floor or a medical floor, depending on what they need. And then from there, depending on what the veteran needs, we would refer them out. So we've been referring out to the community for 38-day residential rehab.
Oh, I see. So you can choose among whatever here, like you're based in South Florida, whatever is available in South Florida.
To a degree.
To a degree,
To
I
a degree.
see.
We have contractual affiliations with some of the community providers.
Uh-huh.
We also have in South Florida, both the Miami VA and the Tampa VA have 90-day residential programs for substance abuse.
Oh, I
So
see.
preferentially, we try to send our veterans there.
Right.
If there's a delay, if the veteran's looking for something else, we try to work with them and accommodate them. And we've been able to get some of the folks into the 30-day community programs.
Excellent, excellent. And does it's obviously free to veterans?
It depends on the veteran status.
Uh-huh.
Usually, if they meet criteria, we try to get it so that it's free. If they have insurance, for example, we try to go
Right.
through their private insurance, because our goal is really to get the treatment.
Right. Well, we have a lot of viewers out there, and if you're a viewer and you're listening and you have a family member, maybe you have a brother or sister or a friend that you know is having difficulties with a substance, whether it's drugs or alcohol, please feel free to contact Dr. Hernandez at his office. And what would be a good website or a contact number where they could contact you or maybe somebody that works under you for some assistance?
Sure. To contact me, it'd be great to contact. You can call the department secretary at 561-422-7250.
Okay, we'll put that up on the screen too as well. And is there a website that they could access?
We don't have a. We have the medical center,
VA.org.
VA.org. You can look
VA.org.
at for the West Palm Beach website.
Okay.
And for veterans, if I may, I'd like to just mention the Veterans Crisis Line,
Uh-huh.
and that's 1-800-273-TALK or
Okay.
1-800-273-8255. And that's for veterans that are in a crisis or they want to talk to someone. That's available 24/7.
You know, that's a great modality to have, like whenever somebody's, might want to use or relapse or whatever, they call this number. Now, is it a live person that answers?
It is, and it's for crisis, and then people can use it if they're having thoughts of hurting themselves,
Uh-huh.
if they're going to relapse. So it's a good modality for veterans to use, and it can hook them up and refer them to the appropriate facilities for treatment.
What are some of the modalities that you use? You know, a lot of places are strictly 12-step based, Christian based. With your in-house therapy and rehabilitation centers, what modality do you use there at the VA centers?
Well, again, other than the inpatient detox, our primary treatment modality is outpatient, and we have two
Okay.
separate programs. We have an intensive program where veterans can come every day.
Okay.
Right now it's 5 days a week, but we're going to be expanding it soon to include Saturdays. And then we have the graduate program for that, which is a little
Right.
less frequently, once or twice a week, or even less frequently.
Okay.
We don't subscribe to a particular program. The VA now is evidence-based, so we only use evidence-based therapies.
Right.
With regards to either the medication piece or the therapy piece, we've been doing a lot of groups and individual work with Seeking Safety, which is an evidence-based psychotherapy.
Okay.
We have folks in
interesting.
substance abuse that work with our PTSD veteran population, as well as our veteran PTSD treatment team, because a lot of the veterans that are experiencing substance abuse are because they have PTSD or have had some kind of traumatic event, whether military related or not.
Right.
And then we do medication piece. And Suboxone's a big player right now. We're trying to expand
Yeah.
that clinic and get that on board with everyone, as well as antidepressants and
Right.
the usual medications that are treated co-jointly for substance abuse.
Do you give out any medications? I'm just curious, like for alcohol, like there's so many medications out there to cut the side effects and the
There's a couple. Historically, the treatment was antabuse,
Right.
which is a medication that one takes,
Mhm.
and then if you drink on top of that, it makes you very sick. And the thinking
Right.
was, if you get sick once, you'll never drink again.
Yeah.
That's not a big medication now in the community.
That was one of the first ones that came out, wasn't
Exactly,
it? Yeah.
exactly. And then there are two big problems with it. One is you get very sick, and
Right.
two is if you don't want to get sick, you stop taking the medicine. So
Right.
now the thinking is we have some medications that are related to the opioid receptor sites in the body
Mhm.
that can diminish the cravings for alcohol,
Okay.
nalorphine.
Right.
So it's something that we use sometimes.
And what's that called?
Nalorphine.
Nalorphine,
That's
okay.
The generic name. I'm not sure what the brand name is because we deal with the generics. And there's a lot of research going on to see if there's any other medications that can actually cut the cravings.
Uh-huh. Now, we have a lot of viewers that are watching, and a lot of them might have family members or friends what would you, if they're going through something like this, what advice could you offer these people out there that are watching that might know somebody that is going through some kind of substance abuse?
I think Florida, there is a good opportunity in Florida with the Marchman Act. And the Marchman Act is basically a legal way where a family member can ask the court system to commit their family who is using to a 90-day rehab, for example. So with the Marchman Act, as a family member, I can go and request that my sibling or my parent be court-ordered for treatment. And that's one option when somebody's gotten to the point where it's become an issue.
Right.
Other than that, I think you got to get the person to identify that they have a problem. I think, as you know, part of the problem is people that are drinking and drugging don't really think they have a problem.
That's always true. I mean, we see that in the
step.
news all the time.
And it's very sad for us as the providers to be able to say to family, well, there's nothing we can do. They've got to want to get better.
Right.
And that's true to a point. Unfortunately, I think what happens is that people really have to hit rock bottom before they realize how much they've lost and how much more they could potentially lose.
Yeah.
And that's really hard to deal with. That's why it's so nice to have something like the Marchman Act in Florida.
So you see, obviously you see great success, right? But you also see great tragedy with addiction and veterans.
We see more great tragedy than great success, and I think that's the nature for the course for substance abuse treatment, which is unfortunate. And I think part of the problem is that it's an illness that's prone to relapse.
Right.
So eventually people get better,
Yeah.
but it takes a lot of relapsing and back and forth to get them better. So I think that I and the folks that work for the service are pretty good about, just sticking with the veteran and giving them every opportunity to succeed.
It really is a sad thing, addiction in our society. We see it on the news every day, whether it's a veteran or whether it's somebody that's in the news. Like lately we had Amy Winehouse. That's a very sad story. And people like Amy really highlight to everybody how prevalent addiction is, how tough it is to kick. And I can just imagine for the veterans out there that go to war, that see really tragic things. PSDS, post-traumatic stress disorder, is very prevalent as it combines with a person being an addict. Is that right?
PTSD is much more prevalent in veteran population than is in the general population, maybe 2 or 3 times as much.
Right.
So given the traumatic experience that some of the vets go through, it does set them up for potential alcohol and drug abuse.
Right.
So I think it's a bad combination.
Yeah.
And then we try to go in and help them with the substance abuse first, so that once they're free of alcohol or drugs, they can deal with the traumatic experience and they can deal with the trauma. And we want to make sure it goes in that order because if you're still drinking and drugging, it's very hard to deal with a traumatic event.
Right.
Because it can make you drink and drug more.
If you could pick one modality, because there's so many different modalities, we have so many guests on that use some great techniques. Some of them are cutting edge, some of them are new, and a lot more are newer than they are, the techniques have been around for so many years. They're just a little more, modern, more advanced. We had Dr. John Connolly on, which uses an amazing technique for trauma. And, he actually claims that in one sitting he can help somebody pretty much from then on out, not have to face those traumatic events in their mind as it goes. And if you could pick 1 or 2 modalities that really work, you say science-based techniques that you use, what would be those 1 or 2?
For PTSD or substance abuse?
For either or both, yeah.
I'd have to say right now what we're doing that is very promising and has a lot of scientific validation is the evidence-based psychotherapies. For PTSD in particular, it's the post-exposure therapy and the cognitive processing therapy. And a lot of it is basically having the veteran in a safe environment relive the traumatic events.
Right.
So that they can process it in their mind, viscerally. And that seems to show very good results when you look at some of the literature behind it. And we've incorporated that throughout the VA nationwide. We've trained all of our providers to be able to provide that kind of therapy. It's very intensive, it's very painful, because by definition you have to go back and re-experience the trauma.
Right.
So we want to make sure that the folks that are going through that therapy
that sounds tough,
aren't
very
drinking
tough,
or
isn't it?
drugging.
Yeah,
Right.
yeah, that's
So
a very
that's what's
tough.
likely to bring them, get them back to relapse.
Yeah. And for substance abuse, for alcohol or drugs, what's the best modality that you guys are implementing and using now that you see that is a success?
We're doing the Seeking Safety, which is a harm reduction model, trying to get people interested in and invested in their own recovery, which is very important, as you know. We want to help people identify the problem and take it from there. But again, it's a little different with substance abuse because the relapse rate is so high.
Yeah.
You just got to stick with the patient. You got
Yeah.
to stick with them and make sure that you're available and the services are available when they need it.
You know, this is such a great show. Dr. Fernandez, you are such a great guest. The information you're providing out there, there are so many veterans out there. There's so many families out there. Now, if somebody was a veteran and their spouse had a substance abuse problem, would they be able to come to you, or is it just for the actual veteran themselves? Does it cover their family?
Usually it's just the veterans. Everybody's different.
Okay.
Some veterans' benefits include their spouse and their immediate families until a certain age. I would encourage the veterans to check first with the VA to see if their family is eligible or not. And then, if not, we could probably assist them in getting something in the community, at least a referral.
Yeah.
We also have the vet centers that we work with. The vet centers are kind of, they're really based on the readjustment model, getting folks back into civilian life after they've been in combat. It's particularly for combat veterans. It started after the Vietnam War, and they do a lot of work with families. They do a lot of work with veterans and their significant others. We do it as well, but we really treat the veteran for the most part. But either of those places, either the VA or the vet centers, can certainly help with referrals out to the community for spouse or children.
So check with their coverage or insurance coverage, their
VA
policy.
benefits.
VA
Sure.
benefits,
Right.
Okay. Because a lot of times, you know, it affects the family as well, right?
Absolutely.
With
Absolutely.
everything. We'd like to give a plug to one of our sponsors, Life Addictions Recovery Program. The Recovery Show has a product. It's called the Recovery Pod. It's a audio recovery program that we downloaded onto an MP3 player. We have one specifically for drugs. We have one specifically for alcohol. And as you can see there, it is a MP3 player that's already downloaded. It comes with headphones, a charger. It's already downloaded. You just open it up, turn it on, and hit play. If you have a drug problem, it works best when you're in meetings and when you're in, counseling. But if you don't have that, if you're not in session, if there's nobody to call, use this audio feedback therapy. It's been endorsed by the likes of Terrence Korsky and many others. We sell it here in South Florida, and actually one of our first sales was the VA hospital in Omaha, Nebraska.
Okay.
They have a research center there, and they bought about 20 of them. But that was one of our first sales several years ago. But we use it in rehabs now. Outpatient providers use it. It's a great outpatient tool as well. If you're watching and you have a family member, please contact us at 717-991-4755 or lifeaddictions.com. What do you think about a product like this? Something that a person can take home and listen to. It's basically audio therapy, feedback, reinforcement. A lot of people that relapse have that stinking thinking going on,
Right.
where they actually forget everything they learned at their session earlier in the day. And we find that this is a great tool. What do you think about something like this?
It's interesting. I don't know enough about the product to comment, but I think anything that can reinforce sobriety is a good
Yeah.
thing. I'm very pragmatic that way.
That's great, great. Yeah, a lot of our people use it. They go to the gym, they work out with it, it's a great way. Today in society, you see so many people with headphones on. You don't know what they're listening to, and that's another thing. It's very anonymous. You could really have it. It's great if you're in addiction, if you're in recovery. We have people that use it after 15, 20 years of sobriety, just to keep that, positive message in there. So we should have you, I should send you home with a couple of these and just to try it out and see if you like it. But doctor, it's great that you've come on. Tell us a little bit more that we haven't covered about your VA center and whether it's locally or nationally, and some more of the great work that you're doing. Share with us something that we haven't covered yet.
Again, just to brag a little bit about our VA center, we are a fairly large VA center. We service over 65,000 veterans in the Palm Beach County and surrounding areas. We do great work. We do all kinds of not only mental health, but general medicine, surgery, surgical subspecialties, medical subspecialties. So we can pretty much provide the care that veterans would need. And we also have access to other sites, that we work with that can get us the specialized care that we can't provide for whatever reason. We do excellent care. We've been one of the highest ranking VAs nationwide as far as our
Wow.
measures for the last few years. We're very proud of that. And we have an excellent leadership team, which is very open to the needs of the veterans, very identified with veterans, and can't say enough good things about it. I would encourage any veteran to seek us out, or any local VA for whatever help they need.
That's awesome. In when I was just talking about our product here, when they our first sale was to the VA center. It was a research center in Omaha, Nebraska, and we actually went back and re-recorded it because we wanted to offer something for the the veterans that might be listening on this device, and we actually directed them. If you're listening, if you're a veteran, you served your country, you did so much, and now you're suffering with addiction. Please visit a VA center. They'll offer you assistance, guidance, recovery. So we direct them to that, as well as to 12-step meetings or whatever. But some of the it's really a tragedy when addiction strikes, and especially it seems like a double tragedy when you survived. Today a lot of our veterans are put on the front lines, whether it's Afghanistan, in the Middle East over there, and then you come back and you're forced with just an addiction on top of that. It really is a double-edged sword, and it almost seems twice as hard, if not 3 times as hard, because life deals its blows as it is, and then you have the post-traumatic stress disorder of being a veteran possibly, and then you have the addiction. So it's very tough. I can imagine the relapse rate would be very high. It's very high in general.
Right.
Yeah.
In general, it's very high, and that's the nature of the illness. I think fortunately, though, for our veterans, we do have the VA centers available, and we do have a lot of expertise, as you know, not only at ours, but nationwide, and we take the problem very serious. There's a lot of money and a lot of funding in the last 5 years to really provide the kind of services that our veterans need,
Yeah.
and we're very proud of it. And we take them all in, and we help them all 150%.
Well, it's so great that more and more, the VA, it's been around such a long time. It's one of those ubiquitous names like the U.S. Postal Service, but it's so good that they're modernizing their, I would love to come by and take a tour.
Absolutely.
And it is just an amazing thing that these guys are doing there at the West Palm Beach VA Center. Dr. Fernandez is one of the leaders in the field, and it's been such a pleasure to have you on and to share all you've shared with us. And again, if you're listening and you need some more contact information, Doctor, if you could please repeat that number, and that the VA.org, right? What number would it be?
VA.org. And it's 561-422-7252.
Please contact a good doctor. And thank you for watching. Again, John Lausch here with Life Addictions. We try to bring you the best guests, the latest in recovery news, the latest in recovery modalities and techniques. And as you heard today, especially for those VA people that are listening, please contact the doctor if you need any help. Thank you so much, and please tune in again next week. This is John Lausch for Life Addictions, the Recovery Show. Doctor, thank you so much.
Thank you, sir.
John,